everybody. We had class tonight. We have a tutoring session on Thursdays, and I thought I'd share something with you from my tutoring session. This comes from chapter 2 of the guidelines for neoplasms, and the title is Treatment Directed at Malignancy. And the guideline states that if the treatment is directed at the malignancy, we designate the malignancy as the principal diagnosis. But there is an exception to this. And what is that exception? If a patient is admitted for solely for the administration of chemotherapy, immunotherapy, or external beam radiation therapy, assign the appropriate Z51 code as the first listed or principal diagnosis, and the diagnosis or problem for which the service is being performed as a secondary diagnosis. So what does this mean? Well, if your patient is coming in for cancer, that's the reason for the visit, that should be the principal diagnosis. But if your patient is coming in for chemotherapy, immunotherapy, or some radiation therapy, according to this guideline, your primary or your first listed diagnosis should be Z51. And let's go over to our next slide and take a look at an example. And I'll give you a moment to code the example. It reads very plainly, so I'll give you a moment to look it over, and then we will look at the answer. So pause the video. Okay, so we have a patient here for treatment. Hopefully you had a moment to read it over. The patient has primary liver cancer, okay? And the patient is getting the chemotherapy agent, which is his first treatment, and then he's going to be observed and sent home. Did you choose A, B, C, or D? Well, we should have been able to rule out A, and we should have been able to rule out C right away because this patient received chemotherapy. So your answer should have been between B and D. D is the correct answer. According to the rationale, the chemotherapy is reported as the primary code with cancer as the secondary. All right, I hope this helped. I'm going to roll it back just a moment to give you a chance to see that slide once again. You can pause it if you need to. And let me show you that rationale once again. Pause it if you need to. All right, this is a question from the AAPC's coding material. Just want to give them their credit, and I hope you have a great evening. Bye.